From buying medicine to groceries, everything is a struggle on a wheelchair, and winters are especially hard for MAXIM. He finds it difficult to live on disability benefits with no access to work.
From November to March, I sit at home because of the weather. If I get sick, then there may not be enough money from the allowance. So I have to save food, and that's without delicacies like pasta.
But beyond a lack of access, there is a much deeper stigma in Kazakhstan for people who have special needs or disabilities. AIGUL says her marriage ended when she decided to keep her son who has Down syndrome. When children with disability are born here, parents can send them to orphanages, a Soviet-era practice of exclusion and abandonment which forces those with disabilities to live under institutional care.
If it's Down syndrome, then the diagnosis will be clear literally in the first minutes of his life. That's why there are so many children with Down syndrome abandoned by their parents.
Human Rights Watch reports physical violence, forced sedation and neglect in state institutions. AIGUL's trying to raise awareness that orphanages are not the solution.
I saw that the attitude towards children is what's towards patients. The treatment was psychiatric and neurological, meaning high doses of psychotropic drugs prescribed for children who were not dangerous to themselves and those around them. I saw some children were tied. I saw children who couldn't eat on their own and being fed carelessly. I saw children who cannot walk, lie in bed all their lives.
There are more than 24 state institutions that cater to children and adults with mental health conditions and disabilities. And approximately 2,000 or so children live as orphans, even though they still have one or both parents. Aljazeera has made several requests to the Ministry of Education as well as the Mayor's office to allow us to see for ourselves whether children in institutions like the one behind me are being abused and neglected, but we have not been granted permission. Kazakhstan's government believes it has a better system than the rest of Central Asian states, but there is still room for improvement.
There are 74 centers for 60,000 children. After in-depth psychopedagogical surveys, the children receive timely correctional support. There are 186 psycho-correctional offices and 14 regional centers where children receive support. But our objective is not to hold them there.
DINARA works as a cleaner, and her decision to take care of her son with cerebral palsy comes with its own set of challenges. Her husband is a laborer, and the little they earn is spent on paying bills and medical care for their son.
Praise be to God. I do not know how, but it is enough for us. We allocate money for rent, food and clothes. We take clothes from other people and don't buy a lot of clothes. What he needs is a lot of the therapeutic physical training and massages. We provide when we can afford.
But with love and care, DINARA's son has improved in the last 9 years. And so has AIGUL's son. His mum wants Kazakhs to see that with inclusion and compassion, children with disabilities can be vibrant and productive members of their society. Osama bin Javaid, Al Jazeera, Almaty, Kazakhstan.